Our next speaker is Dr. Ravindra Kumar CHOWDHURY. He'll speak on Sunetra.
A very good afternoon to all the respected dignitaries present over here. I will be discussing today Sunetra, the first universal eye health program in Odisha. India accounts for 1/8 of the blindness and 1/4 of the visual impairment throughout the world. For prevention of blindness and visual impairments, which are the initiatives that has been taken globally and is at national levels and is at state level, Sunetra, which comes under universal eye health. As we all know, Vision 2020 Right to Sight is one of the most important breakthrough in control of blindness and visual impairment in the world. To strengthen the objective of Vision 2020, WHO made a resolution further in the year 2013 in its 66th World Assembly as Universal Eye Health, a global action plan. Under these resolutions, it set a target for its member country to reduce the prevalence of avoidable blindness and visual impairment by 25% by the year 2019 from the baseline of 2010. Odisha had low eye care indices as compared to other states of India. Comprehensively scientifically designed survey of blindness and visual impairments had never been done in Odisha. Recognizing this fact, the state leadership of Odisha launched the Universal Eye Health Program on World Sight Day of 2017 as Sunetra to strengthen the eye care services of the state. Odisha was the first state in India to implement this universal eye health coverage as Sunetra from the year 2018 to 2022 as its first phase under a slogan of Eye Care for All by the year 2022. Approximately 117 crores have been released for this program over 5 years. Now it is an ongoing project and has been renamed as Surendra Sai Divya Drushti Yojana during the year 2024 and 25. Sunetra aims to reduce the preventable blindness and visual impairment by provision of better eye care service for all by strengthening infrastructures and skill development of human resources. Department of Health and Family Welfare, Government of Odisha, made a Empower Committee to fix some strategies to implement this program in our state. They plan to assess this magnitude of blindness and visual impairment of the state and use of already developed tools for gap analysis of both resources and performance at the district levels to strengthen and empower the existing pyramidal healthcare level of the state, capacity building with appropriate training and placement of trained eye health personnel at the district levels, and to digitalize the eye health data for a future big data analysis, and special focus was given in eye care for the children, and to create a center for skilling and planning, and to bring synergy between public and private eye health care providers. Coming to the achievements from 2018 to 2023, to prevent visual impairment due to refractive errors, 8.9 lakh spectacles have been supplied to the beneficiaries of all age group with refractive errors. To provide comprehensive primary eye care health care, fixed vision centers are being established at each community health centers in a phased manner. Out of requirement of 372 fixed vision centers, constructions of 250 fixed vision centers have already been completed, and approximately 22.03 lakhs people have been benefited by these fixed vision centers. To improve the quality of eye surgeries in our state, modular IoT in 8 government medical colleges are already being established, and in other rest 4 government medical colleges it is under process. To provide eye care services to the unreached populations and tribal areas or something like that, and strengthen the referral service, mobile vision centers are functional in all the districts of the state. The mobile vision centers are functional with hired vehicles and ophthalmic equipments. Ophthalmic officers move with these mobile vision centers and cater the service to the unreached areas. With this, 2.75 lakhs people have been benefited through these mobile vision centers. Ophthalmic instruments and equipments have been supplied to these fixed vision centers and all mobile vision centers to improve the quality of examinations. Regarding school eye health program under Sunetra, screening of all the students from class 1 to 10 of all the government and government allied schools are done by trained teachers. Vision checkup of all these referred students with suspected vision problems by these trained teachers was done at camps, at block levels, and at medical college levels by the ophthalmic assistants or ophthalmic officers.
How many slides more?
One more.
One.
Approximately 2.42 spectacles have been supplied to the school children. So these are these COA and 90 seats of COA, certified ophthalmic assistants and certified surgical assistant course have been introduced, and 15 days of refresher course of existing ophthalmic assistant has already been done in 3 premier medical college. So to conclude, the ultimate goal of Sunetra is integration of eye healthcare to the general healthcare systems. Achieving these short-term goals as important as laying foundation for long-term plans, and Odisha could be the model state in India in universal eye health coverage. I acknowledge this present member of this unit under Universal Eye Health Society for sharing their data to me. Thank you for your kind attention.
Thank you, Dr. Ravindra.
Any steps have been taken for digitization of the data?
Yes, madam, there was a slide because due to lack of time I just omit that. For the actually the idea of digitalization came to Sunetra from a organization called IRIS in US. It is called Intelligent Research Insight. This is a first electronic data record in America. They have taken that idea to implement this digitalization data in our state, and for that they first appoint a data entry operator to include the different patients' data. Later on, government decided to merge with Odisha Management E-Information Systems. It along with this vision health parameters, it also includes the other health parameters. So that will provide a big data analysis after a few years. That will help in the research purpose.
Thank you, Dr. Ravindra.